The Edmond City Council is now called to order. I want to thank you all for watching. The Edmond City Council is conducting a special meeting tonight to review our current proclamation and ordinance related to the COVID-19 pandemic. We also plan to discuss some issues since the last meeting and ask for reports for staff and updates on the implementation of the mask policy. My name is Dan O'Neill, and it's my honor to serve as your mayor. I am located tonight in the Edmond City First Building in the mayor's office, and I will now ask the city council members to introduce themselves and tell the audience the location of your broadcast. Nick, can you start?
Nick Massey, Ward 4. I'm in my home in Northwest Edmond.
Okay. David?
I am in Ward 1, downtown Edmond, in the Chapman House.
Okay. Josh?
Josh Moore, Ward 2, and I'm at Arcadia Lake right now.
Is that in Ward 2?
Absolutely.
Okay.
The
Daryl?
Adventure District.
Daryl Davis, Ward 3 Councilman. I'm currently in the law offices in City First.
Okay. We also have city officials and staff members on standby. Larry, would you introduce yourself to the audience?
Hey, Larry Stevens, City Manager, and I'm in my office at City First.
Okay. Mr. Murdoch, would you introduce yourself and the members with you?
Yes, it's Steve Murdoch, City Attorney, along with Cindy Coville, City Clerk. We're here in the City First Building.
Thank you very much. Matt Stillwell, our Emergency Management Director. You there, Matt?
And Matt is here, but he's muted right now. Do you want me to bring him up at this time, or did you want to wait until you're ready?
That's fine.
Okay.
And we also have Latoya Knighton, who is the Executive Director for the Oklahoma County Health Board. Latoya, glad to have you here. Thank you for participating in our meeting tonight.
Thank you, Mayor. Glad to be here.
Okay. Do you have anyone with you yet?
Yes, Phil Maytubby should be joining. He is on. Looks like his camera is off, though.
Okay. Thank you very much. Appreciate it.
Phil is our COO, and I'm our Chief of Government Affairs here at Oklahoma City County Health. Thank you.
Thank you. Welcome, Phil. Thanks for coming. Oklahoma statutes now permit during the national COVID emergency to hold public meetings remotely, like a city council meeting. The rules permit either audio only or visual and audio together. We are doing a virtual meeting because we are using the Zoom app. I'll ask our city attorney to Mr. Murdoch, if you would repeat the conditions for this authority, as well as how we are going to conduct this remote city council meeting.
Thank you, Mr. Mayor. The Edmond City Council will close the council chambers and hold its special meeting this evening by video conference. This change is to protect the public health while maintaining critical operations and is in accordance with the recent changes to the State Open Meeting Act that set out in Senate Bill 661. The changes define how to hold open meetings remotely during the COVID-19 pandemic and national emergency. Each member of the City Council and member of the city staff are participating remotely via video conference. The posted agenda provides notice to the public on how to watch the meeting and connect to the meeting. Also, should the connection with any one of the council members present for the meeting be lost, the meeting will be recessed to reestablish the connection. We will recess the meeting up to a maximum of 30 minutes to reestablish the connection. If reconnection is not possible, the meeting will be reconvened possibly Thursday, October 8th, or at a later date and time. Thank you, Mr. Mayor and Council.
Thank you very much. Mr. Murdoch, since the purpose of this meeting is to approve or disapprove an ordinance and extend our declaration, we will entertain public comment on those. Is that correct?
Yes, sir. Item
Okay.
2 is a public hearing and consideration of an ordinance 3799, amending Title 5 the Edmond Municipal Code, Health and Sanitation, Chapter 5.18, COVID-19 pandemic, by amending Section 5.18.060, effective and expiration dates and times, possibly declaring an emergency and providing for repealer and severability. That's item 2. And item 3 relates to an update from city staff and discussion and consideration of amendment to revised declaration of emergency regarding COVID-19 issued on August 24th, 2020. Those are the 2 items for our agenda tonight.
Okay, so we will entertain public comment. Mr. Moore, would you explain to the audience the rules rules and how they will conduct public comment?
Yes, thank you, Mr. Mayor. When we reach the point where the mayor asks for public comment, we ask that you use the raise hand feature. You can find that in the participants tab, and we will work that way. In the meantime, we ask that everyone please leave their cameras off for our broadcast. If you have phoned in tonight, you can raise your hand by hitting *9. So when we get to the point where the mayor asks for public comment, we'll kind of go over the rules at that time, but we will use the raise hand feature.
Council, any questions for Mr. Moore? Nick, you were talking a little bit about some issues on the public comment.
Yeah, I just wanted to bring up something for council consideration that doesn't have anything to do with the mask ordinance or anything, but I heard from a number of citizens who are concerned about the Zoom meetings, and they feel kind of disenfranchised. Not everybody is just real tech savvy in terms of getting on a Zoom meeting, or even if they are, they're not sure what to do. They can call in, of course, but even then what we're losing, which I think is so important, is that personal connection with our citizens and the people that elected us and the people that we're representing. And a lot of people feel like they're a little bit disenfranchised. So I hope the council will consider our next council meeting, or just absolutely as soon as possible, we go back to meeting in council chambers, and we can manage that like we have in the past by some social distancing and limiting the number of people in council chambers. We could probably even have some people that are not comfortable, they could call in by Zoom and address the council that way. But we need to get back to that personal one-on-one interaction with our citizens, because I think it's sorely lacking that. And I keep hearing about it more and more from people. So please consider that.
Take that into consideration, and a good point. Heard some of the same concerns, and I'm sure some of the other council members have also. Well, the first item of business, it was read by Mr. Murdoch, is to extend or not extend our proclamation, and then extend or not extend our mask ordinance. I would like to start with a report from Larry on how it's going so far from the city's perspective in terms of enforcing the mask ordinance.
Okay, thank you, Mr. Mayor, members of the council. We now have 11 employees who have tested positive for COVID-19. We also have 16 people in quarantine, and 2 of those are working remotely. And again, those totals are out of almost 800 full-time city employees. The staff is continuing to work on finalizing our last request for CARES Act funding. Just as a reminder, this is reimbursement funding only, and we have been informed by the state that we are eligible for up to $7.2 million. We have requested about $6.3 million to date, and we will request the balance of those funds as we get closer to the end of October. I believe the formal deadline is November 1st. We still have restricted access to all of our city buildings, and masks are required to enter. Again, since the mandatory mask ordinance went into effect on August 26th, we have made the Community Image Department our point group for complaints. We respond on a complaint basis only. We've still issued no citations since the ordinance went into effect. Our people have now responded to 47 calls concerning the ordinance. We have responded to all calls in person. That has mainly involved Ivan Smith from our staff. 13 letters have been sent to places where we have received multiple complaints. And our call taker has told us that the calls appear to be recently trending to be more frequent in the last week or two. So with that, Mr. Mayor, that concludes my report. I'll try to answer any questions that you might have.
Council, any questions for Mr. Stevens? No. Appreciate your work and appreciate staff's work on this particular item.
Thank you.
Matt? Mr. Stillwell?
Just a second.
We get a report for our Director for Emergency Matters, Emergency Management.
Just a second, we'll get him up here. Okay.
Okay, thank you, Casey. Good evening, Mayor and Council. I continue to pray that everyone's safe. The City County Health Department will be speaking, as you know, the Mayor and Council here in a little bit. So a lot of the numbers I normally cover, I'm going to go ahead and let them do with their charts and their graphs. I will talk briefly about our Edmond specific numbers. We currently have 1,669 cases since the beginning of the event. I've been doing that 2-week average and reporting at our meetings. So a week and a half ago at a regular council meeting, we were just shy of 20 cases per day for the previous 14 days. As of today, we are just above 20. So we've raised about an average of 1 since our meeting, which I think was 10 days ago. And that being said, those are the raw numbers that I have. I really don't want to steal any of the thunder, but I do want to mention how appreciative that our department is, and I know the city is, of our partnership with the Oklahoma City County Health Department, with LaToya and Phil, and there's many other staff people down there that we're in contact with on a regular basis. They've been very transparent with us and very helpful with any questions that we've had. So I did want to recognize their hard work.
Thank you very much, and I agree with any questions, Council, for Mr. Stillwell. Very well, thanks. Matt, do you want to introduce LaToya?
Sure. Oklahoma City County Health Department, we have a meeting every Friday, so I get to see LaToya's face every week, and again, very, very thorough in the information that they provide to us. So without further ado, I'll go ahead and introduce LaToya Knighton, and Phil Tubby is also here from the Health Department, and I believe he has some information to share.
Thank you. Thank you, Matt, and thank you, Mayor O'Neill, and to the council for this opportunity to present tonight to give you some information on where we are currently at as it relates to the COVID-19 virus. I also, again, want to introduce our COO here at the agency, Phil Tubby. He and I will just try to tag team any questions that you may have tonight. But before we get to questions, I want to just walk you through the data, as Matt mentioned. Are you all seeing my screen okay?
Yes, ma'am.
Okay, wonderful. So this is just a quick overview of the cumulative case counts, both here in Oklahoma County, the state, and across the nation. As you can see, as of October 5th, we were at 19,307 confirmed cases in Oklahoma County with 197 deaths, 93,346 cases in the state with 1,066 deaths. And of course, we have reached a very sobering statistic in the nation with 210,181 deaths. Today, we are most concerned today with the rate of our hospitalizations. Probably around 4 weeks or so ago, we noticed that our hospitalizations were beginning to trend upward, and they have stayed consistently high. We are averaging in the 180s in terms of daily hospitalizations here in Oklahoma County. As you can see, where it says up 5, that is just a one-day difference, if you will. And so you can see, of course, with the Metro, Oklahoma County, Cleveland County, and a Canadian county combined, we were at 236 hospitalizations as of October 5th. In looking at, again, how our daily case counts are trending here in the county, as you can see, this chart just goes back to late August, but really throughout the months of July and August, when most of the mask ordinances here in Oklahoma County started to be implemented, we were averaging in the low 90s to, or high, excuse me, the 90s to the low 100s in terms of our daily case counts. We have been on a steady incline since that time. One thing to remember, of course, when the mask ordinance went into play, we were also at a steady incline. And we know that municipalities across the country, the data tells us that cities that do not have mask ordinances, they are averaging about a 30% higher case rate count than municipalities and counties that do not have any, or that do have mask ordinances. And so, although these numbers are continuing to trend up, you know that the virus is widespread still in our community, and we are certain that these numbers would look much worse if we did not have the collective mask ordinances here in Oklahoma County that we currently do. So this is just a quick snapshot of how the metro area is looking, again, including Cleveland and Canadian counties, along with Oklahoma County data. And counselors, please stop me at any time if you have questions about any of these charts. Now, one thing I'd like to point out in terms of the deaths that are occurring in Oklahoma County, as you can see, this, of course, is a chart that is trending in the opposite direction from all of the other charts that I've shown you this evening. While we are very thankful that we're not seeing the level of deaths today that we did at the beginning of the pandemic, and of course, that's due to, you know, now our hospital systems and our doctors, we have pharmaceutical interventions today that we didn't necessarily have back at the start of the pandemic. But what is concerning is that even though, you know, we are not necessarily losing as many people as we did at the beginning of the pandemic, people are still being severely impacted and having severe complications and therefore needing to be hospitalized. More people hospitalized with the virus, and so that is particularly concerning. So again, our current hospitalizations, you can just look at that trend going back to the early part of September. We've continued to trend up, and as you can see, starting around the later part of September, we have really hit this new high where we are consistently staying in the 180s each day of folks that are hospitalized in Oklahoma County. And then again, wanted to give you a picture of what those severe hospitalizations, what that data looks like. Similar to our hospitalizations graph, we have been trending upward, and we've sort of reached this new high that we're currently staying at. So are there any questions related to this data?
I have one question on the hospital, the capacity there. When we say that the numbers are trending up, and those are we're just counting the COVID numbers, correct?
Correct. These are COVID hospitalizations. Yes, and again, another big concern that we of course have. You know, we've been talking about hospital surge and making sure that our hospitals have capacity ever since the start of the pandemic. We are now, of course, entering the flu season, which, you know, that's also a concern that we will have to contend with COVID patients hospitalized at the same time as influenza, which we all know that influenza, we have hundreds of Oklahomans that are hospitalized due to influenza every year. And so it's going to be critically important that we keep an eye on what these COVID hospitalizations are doing, because again, now that we are in the fall season, we have a very real threat that we could be maxing out our hospital capacity with flu and COVID impacting our community at the same time.
And how do we feel about our capacity with the frontline staff of those frontline workers who are at the hospitals were they able to get a breather for a moment, or are they still running full throttle at this time?
You know, I'm going to let Phil, if you're on, Phil is in touch points more closely with the hospital association, and he may have some insight there. I know that I've been hearing, of course, that all of our hospitals are trying to hire staff. There definitely continues to be staffing concerns, particularly as it relates to nurses. It's the same story with, schools and teachers. We're always competing with states like Texas, just next door for teachers. We're having the same problem with this pandemic where our hospital systems are definitely still needing and have open positions for staff. Phil, have you heard any more insight from Patty over at OHA?
No, I think what you said is pretty accurate. I mean, nationwide we have a nursing shortage, so we're always competing with other folks for nurses for the same thing, and that will continue to be the case. So I haven't heard any urgent cries for help, from the hospitals, but they are concerned with the levels of the hospitalizations. So what's happened, and if you just want to, in general, look at the difference in now and what it looked like back in May. Back in May, we had a lot of, we started getting increasing hospitalizations, and we didn't have a lot of wiggle room to fill as far as bed space. We have increased our capacity for bed space, but along with that, we've also increased our cases. So as we move forward into this, our room to absorb a lot of cases is getting smaller. So this is another one of the reasons that, we always are going to push for masking as long as we need it. We're just like everybody else. We don't particularly like them, but we know they're effective. So that's what we're going to do.
Thank you.
Okay, any other
questions, council? Okay. Go ahead, LaToya.
Oh, I was just going to say, any other questions on the data? Okay, I'll go ahead and pull that chart down if that's okay.
Any other questions, council? Thank you all very much for coming, Mr. Maytabi and LaToya. We appreciate you very much.
Absolutely.
All right. The next question really is for Mr. Murdoch. The ordinance number is for this new ordinance, a public hearing consideration of ordinance number
3799.
3799 amends Title V of Edmond Municipal Code, Health and Sanitation, Chapter 1518, COVID-19 pandemic by amending Section 5-18060, effective and expiration dates and times, declaring an emergency and providing for repealer and severability. The expiration dates proposed was for to extend the amendment to 30 November. Is that correct, Mr. Murdoch?
Yes, sir. Our current ordinance will expire on October 12th, and the only change to our ordinance is that's presented to the council tonight is to extend that expiration date to November 30th, 2020. No other changes.
Okay. Council, it's sort of an opportunity here now for you all to speak on your position with respect to the proposed ordinance change. Anyone want to go first?
I'll go there. Thank you for Oklahoma City County Health Department for being here and sharing that data with us. I mean, I'll keep it brief. My position hasn't changed from my earlier votes that, wearing a mask and trying to organize effort across our city.
Hey, Josh, we're having trouble hearing you. You're having some connection issues.
Okay, can you hear me better?
You're cutting out. We can't hear you at this time.
Go ahead and move on.
Okay. Mr. Mayor, I think he's going to try to get a better connection.
Okay. Do we want to wait?
Well, he's still connected. I
okay.
think he's probably just going to move so that he gets better reception, I think.
Okay. Daryl, you want to take over?
Yeah, I appreciate, just like Josh was, I think, trying to say there, the Oklahoma County Health and the information there. As I said before, my concern has always been we talk about the number of cases, but the people that are recovered who are still having issues and problems after that. I've always wanted to keep businesses open in the supply chain, and I've always felt that masks were the way that we can do that and keep society and economy moving forward. As I said before, we're all in this also together. That I would like for people to understand that there is a group of community people out there who do not like masks, but and I've heard from other people that they're being harassed because they don't like masks or they do like masks. And I just plead to the community, let's not do that. That if everyone has their own beliefs and their own desires, but the harassing of one of our own citizens, to me, is not acceptable. And I would just plead to the citizens that if you are one of those, if you know someone's doing that, please stop. But I am in favor of extending the mask ordinance as it is today until the numbers start coming down. Someone asked me the other day, what number is that? And if we can get down to a positivity rate of 5%, that would be great. But our positivity rate's not even going down, it's going up. So how do we overcome that as a community? That's my overall concern. Thank you.
Josh, are you back with us or are you still?
Yeah, can you hear me now?
I think so. Casey, does it sound okay?
Yes. Yeah, we can hear you just fine. Go ahead, Josh.
Okay. Thank you. Yeah, I want to thank what's beginning Health Department for being here and sharing that.
Actually, Josh, now we can't hear you. You're cutting out.
Okay, just move on.
Hey, Nick, do you want to speak now?
Well, as you know, in the past, I've been opposed to this ordinance, and I remain so. But I would like to defer my comments until after the public has had a chance to speak for and against.
Okay. If you don't mind, Casey, do you have my charts available when I ask for them?
Yeah, are you ready for those?
Well, not yet.
Okay, yes.
I just want to say that I want to thank some of my friends for helping me very much with dealing with these numbers. One of the first lessons that we learned about the COVID is that it takes about 2 weeks for us to know if you have exposure. That's when the symptoms start to show and you go to the doctor and you're having problems. So when we do something and it increases the exposure or decreases exposure, we will know 2 weeks later what the results will be, if they were effective or not effective. And so using that particular understanding of the illness, we've been charting the number of cases, new cases in our community for some time, and trying to define actions and events that we believe have actually significantly changed the numbers of cases that we have reported in our community. We've been trying to do this with Mark Nash for some time, trying to state not just how many cases we have, but it's intended to show how general population behaves and reacts to both public and private sector policy decisions. In April, our city council, we lobbied with the governor and state officials to have the county health folks provide us city-specific information. We were getting it on the basis of the county, or we were getting it on the basis of zip codes. And that just wasn't helping us because our boundaries don't necessarily include just parts of some zip codes. Well, we finally got the information, and we were very grateful for the governor coming through and helping us on that. And we got our information. So it was June 7th, I think, when we first started charting the new cases that were reported for the city of Edmond based on daily information provided to Matt Stillwell, our emergency management director. These numbers came from the county health department, and it was a collaboration between Matt and them as to whether the citizens that were identified lived in our community. This information was important to emergency management because our first responders need to know if they're being sent to a house, be it the ambulance, be it the fire, be it the police, be it animal control, or be code enforcement. They need to know whether or not there's a COVID case at that particular location. And so that was our public need to know that information. Now, we had that zip code information available starting on the April 8th. When we had the cases between April 8th and we finally got the Edmond specific numbers in June, we had an average of 8.8 of new cases every day. That's what happened, okay? When the governor, we implemented the UPS program. Some of you may remember that. That's the getting us back to business. On the 1st of May, we started undoing the things that we made to stop businesses and started gradually bringing the new businesses on. It took us a whole month to get through those 3 phases of the UPS program. And so by the end of May, we had a pretty good increase or situation change. And we were able to track the impact of what it took as a result of these things happening. So there you see on this chart here, from April 1st to June 6th, we had an average of 8 new cases per day, but that was using zip codes. In May, the UPS program began. And 2 weeks after it was started, on June 15th, we saw a noticeable change of 7.2 cases that were Edmond specific. So that's pretty good to have accomplished all of that and made those changes and increased our risk. That's pretty good to accomplish those things. And actually, our total numbers really were less than they were for the total zip code. On June 20th was Father's Day. And 2 weeks later, we noticed a significant change, and we attributed it to the Father's Day, where people participate in activities of the family and with their friends. They call them gatherings, and they call it just good old American fun. But the average increased from 7.2 to 15.9 cases, and that concerned us. Council, can we go down just a little on that chart? There you go. The council mandated a mask notice, okay, on the 20th of June. This wasn't the mask mandatory wearing ordinance, but we posted a requirement that all the businesses publish their mask policies, publish whether their employees were required to wear them, publish whether they are maintaining social distancing, and publish whether or not the customers were expected to wear the mask. And perhaps add the information of, yes, we're also providing masks if you don't have one. And on the 3rd of August, 2 weeks after we adopted that policy, we saw that the new cases dropped from 15.9 to 10.7. Now, during that same time, Oklahoma City did pass their mask ordinance, and it was effective. Our mask ordinance was passed, but it did not go into effect until August 26th. So there was a lot of things happening and a lot more emphasis on masks and a lot more emphasis on trying to protect citizen exposure in our community. And it proved to be very successful. It proved that we were able to reduce our numbers about a third. And we thought that was pretty good. Next page, please. When UCO started back on the 11th of August, 2 weeks later, we saw a definite increase in our cases in our community. And that's just not that long ago. So all the efforts that we had on the masking, it will have minimized this number here But we did increase, and we went back to 16.2 cases. During that same time, Edmond Public Schools reopened on the 24th of August. And with another significant bump out of UCO, and we were able to study their cases, we've had an increase that has gone from 16.2 to 20.3 cases per day. And that's pretty much where we are at today. That's the same number that Matt said that he found for our averages today. So we are monitoring this very closely. We've had some significant increases. We can trace what's causing some of the changes and make a pretty good estimate on what's causing them. And anyway, I just want the citizens to know that we're doing pretty good. This is a little high. It's higher than what we have had in the past. But the most important thing that goal for our community right now is to get our schools back in business, to get our teachers and students hopefully become more full-time. This will allow their parents to go back to work, and it will allow our community to turn back to normal. But that's basically the thrust of why we're doing most of these activities now, is to minimize the effort and promote and support the effort of the Edmond schools and the university to get back to full-time classrooms in our community. That to me is the most important thing that we have to accomplish in our community. And it's very important. But I wanted to let the citizens know that we are tracking these numbers. And I want to thank Mark Nash for all of his due diligence. He is a process engineer, an industrial engineer who works in the business of manufacturing and statistics. And this is a very, very important information to us from our community. Thank you. David, do you have any comments you want to wait, or do you want to wait till later?
I'd like to hear from our citizens.
Okay, thank you. At this time, we will open for public discussion. The ordinance for consideration. The effort proposed is to extend the mask requirement to the 30th of November. So,
anyone that would like to speak during this public comment session, we ask that you use the raise hand feature at this time. And we'll work that direction. We will provide up to 5 minutes if needed. If not, we ask that you cut your comments off before that time, and then we will work through that. Anything else, Mr. Mayor, that you would like to add before we start public comment?
Well, you're having up to 5 minutes. It doesn't mean that you have to speak the entire 5 minutes. We would like for you to keep the information. Do not repeat yourself or the comments that have been heard. Many of you had taken the opportunity to send us emails, and we appreciate those. And it's not like we haven't heard most of these comments before. So if you would, please keep your comments brief and short and to the point. Thank you.
Okay, we'll go ahead and bring up our first hand here. Once we get you up and unmuted, if you would please introduce yourself. Okay, go ahead.
Okay, thank you. Gentlemen, first off, my name is Dr. Wes Hill. I'm a lifetime citizen of the city of Edmond. I've practiced here for 20 years, and I'm actually, as the mayor said, I'm coming to you guys on behalf of 17 other physicians from the city of Edmond as well, so we could save a little bit of time for you guys, and you didn't have 5 minutes from all 17 of us. I know many of them, including myself, have emailed you guys about our concerns, and I want to start off kind of getting to the point so we're not wasting time here. Our concern is not to debate whether masks are effective or not. What we feel is that the council themselves has kind of, in a way, taken away our freedom to decide that. And rightfully so. We believe that it's an emotional situation. We believe that, you all made the decision for good reason and in good faith. But in essence, our right to choose as citizens of Edmond, I come to you more as a citizen than I do a physician. As citizens of Edmond, our right to choose has been taken away from us. So we were requesting a couple things, if we could, that we feel it's kind of the duty of the council for making this decision for us and taking away our freedom to be able to decide. We request a couple things. And I think you covered one of those things, and that is that if our right to decide has been taken away as a citizen, I would think it would be the duty of the council to prove to us that you guys have changed with your choice and decision. You've changed the potential outcome of what was going to happen when we were being trusted with the decisions to wear a mask, not wear a mask. And from the numbers I see, they're going up. We know it's a virus. Viruses spread. They're going to spread when people, like the mayor said, when we get together, but we're humans, we get together. Edmond's a friendly place, right? So our first concern is in taking away our option to decide for ourselves, have you guys affected, has the mandate affected the outcome? I believe that it's the duty of the council to kind of show us that it has affected it, because it seems like the numbers are going up, which they should have and they would have. The second part that we've all kind of discussed, and we feel it's the duty of the council, well, what's the end game? I know low numbers, we all want this to go away. I think every citizen here wants this to go away, but it's not, it's a virus. And, is the end game the governor who did not put, forth a state mandate? Is it the governor removing the state of emergency? Is it a specific number? What is it? So we as the constituents, the citizens that voted y'all in, what is it we're looking for? We can see some of the charts that you guys have, but clearly, Mayor, you have access to more information than we do, and I appreciate you sharing that with us. But what is the stated end game? And I'll end on that and just let you guys know that we do appreciate your efforts. We do. And we look forward to this all, getting back to normal. Thank you.
Thank you, Dr. Hill.
Okay, bring up our next one here. Once we get you need to go ahead and unmute. Okay, go ahead.
This is all kind of new to me because I have a new computer that I've set this up on. I kind of just want to reiterate what
Please introduce yourself also.
Oh, I'm Cheryl Williams, and my husband and I live at 1300 Lapwing. We've been Edmond citizens since 1988. I just want to kind of reinforce what the previous gentleman said. What's the end game? When will this end? And I have to also say that the ugliness that has come into our community because of this mandate is haunting. When people you don't even know come up and attack you, people scream at you. I am unable to wear a mask. I mean, I almost pass out from the inability to breathe. I've tried to tell you my story and what I went through. But I'm not the only one that has PTSD. I am not the only one that has problems. There are significant others. But my question again is, what's the end game? When will it end? And when will the ugliness in our community be gone? I would like to see us go back to where the businesses decide. If they want people to wear a mask in there, they decide that. But we need to get back to a community that works together and heals together, because we are a caring community. It's just become a pretty ugly place nowadays to go out shopping. And I've got to tell you, I get very concerned we drove up to a restaurant last night, and because of just some actions that we saw inside, we turned around and left because it scared us. We weren't sure we would be welcomed without our mask. So that's what I'm asking. My other thing that I would like to talk to you guys about is what they call excess deaths. It's a new term I'd never heard of, and it's the deaths that are a result of these mandates. It's not the virus, it's the suicides. It's the depressions. It's the members of the community who have lost hope because they don't know when they're going to go back to work, or when if their business will even survive. The excess deaths we're seeing in our communities and state, we need to be concerned about that. Let's try to get back to a normal life. And we can do that if we will just let businesses go back to deciding what they want to do, give citizens the right to decide. And I think that will at least begin to heal our city. And I think it will also help to heal us from the virus because we'll be hot, nicer, and maybe we won't be so ugly. And maybe that stress has not helped the virus to go away. So I just ask you to please just stop and let's end this and become a happy city once again.
Thank you very much, Cheryl. Appreciate that.
All right, just a second here. We'll get our next one. Okay, let's get you unmuted. Okay, go ahead.
Hi, I'm Dr. John Harkis. I'm a longtime Edmond resident. Live at 221 North Cedar Mountain Avenue. I'm an infectious disease specialist working at Mercy. And as we've seen, the numbers of cases have been increasing in both our community and the state as a whole. Increasing evidence showing up these days that masks do help prevent transmission of this infection. They are effective. And it makes no sense when the epidemic is out of control, I think, to stop public health intervention that helps prevent transmission. It just makes no sense to stop now when the epidemic is heating up. The cases that are reported that we're looking at, those numbers that we're seeing, are just the people who've been tested, formally diagnosed as having coronavirus and reported to the state health department. But the actual number of people who've acquired this infection is much higher. People are estimating something like 5 to 10 times as many cases are actually occurring as those that get reported. So this is a big epidemic. Our state has per capita infections has been in the top 10 for the last several months. And it makes no sense to stop a public health intervention that has been shown to be effective in preventing transmission at this point. The end game question is not, it's obviously not the time to stop these interventions now. And I would suggest that when cases are much lower, it may be reasonable to stop. When we have access to a vaccine, maybe in the coming months, and people can get immunized for this, then we would consider doing it. But when the epidemic is roaring ahead is not the time to stop. Thanks very much.
Appreciate it, Dr. Harkin. Thank you.
Okay. Our next one up. Go ahead and unmute. Okay, go ahead.
Hello, my name is Liz Miller. I live at 2205 Cedar Point Court in District 4. I would like to first address something that the last gentleman said. He said that the numbers may even be higher than reported, as those are the people that have been tested and diagnosed. And I agree with that fact. But if that is the case, then that would stand to reason that, in fact, it is much less deadly than being reported. Mayor O'Neill, you discussed opening schools and how we want UCO to keep going, and we would love for the kids in Edmond Public Schools to go back full time. I couldn't agree more. I'm a single mom. I work full time. I have 2 girls. However, I don't think the mask mandates are doing it. I think it's kind of a moot point for Edmond to have a mask mandate and think that that affects Edmond Public Schools opening, as they have explicitly stated they're following the Board of Education's recommendations, and they will only go to 5 days a week if we hit the yellow mark as a county. The yellow mark is very low. We've somehow shifted from going to a slow the spread and worrying about deaths to now we are worrying about a positive infection rate. But more importantly, I think that whether there's a mandate or not, people are set in their ways. You guys questioned before you implemented it the ability to truly enforce it. And I'm going to go a step beyond that and say that the people that want to wear masks already are, whether there's a mandate or not. And then there are people that aren't going to. I don't think that people should question what a business wants to do, but I believe that that should be left up to the businesses, and that you should trust your citizens to make the choice that's best for them and their families.
Thank you very much, Ms. Miller. Appreciate that.
Okay, let me bring up This one is over the phone. I believe it's Carolyn. Carolyn, if you could unmute. Okay.
Hi, my name is Carolyn. My name is Carolyn White Mulholland, and I'm a longtime citizen of Edmond, and I know most of you guys, and I find talking in public really stressful, so hopefully my voice won't crack too much. I'm going to read what I sent to our city council members, and then I'm just going to say a couple little things. I'm going to do this fast. You know, I hope you and your family are well and staying healthy. I honestly don't know the answers for the mask mandate, and I'm so glad I'm not in your shoes. I wish we had leadership from the federal government that had clear and non-conflicting science-based guidelines that would help state and local governments base their decisions on that. This virus is something as a nation we haven't dealt with recently, and hopefully this will provide the incentive for the next global pandemic, because this is going to happen again. And I don't care which party is in control. I vote for people, not for parties. Mask mandate or no mask mandate, I will be wearing a mask until this virus is under control. First, there's no way for me to know if I'm infected. So I keep hearing personal responsibility. What about personal compassion and personal empathy? I've been tested twice, and both times I got tested was I was more worried that I would spread this virus to my fellow human being than I was worried about myself. I want to protect my fellow humans from getting this virus. Second, I'm autoimmune compromised and I don't want to get sick. I don't know the long-term effects of a virus. I have a friend whose 32-year-old daughter has been sick since March. She has run a fever since March. She's called a COVID long hauler. I don't want to add to the burden of our overwhelmed healthcare providers, and I really want to live at least another 30 years. I have been praying for you all in this difficult and challenging time, and I too pray that our community will use their inside voices and choose their words as if they were talking to a friend or family member, and not see you all as adversaries, but we work together in this wonderful place. I am so sick of hearing the word freedom and personal responsibility. I don't understand when every ordinance that you guys have passed since you've been in office limits somebody's freedom and somebody's personal responsibility. I don't understand why these words are so important. You all passed stop sign ordinances to protect people. I got a stop sign in my cul-de-sac to protect people. My daughter was in a car wreck, and most of you know she died. Travis, her boyfriend, was personally responsible for that car wreck. 20 people died at that intersection, over 20 people. So what did the government do? The government said, hey, let's make this intersection better. Let's put in stoplights so that people will notice that this is a dangerous intersection. And that's what a mask does. A mask not only protects me from getting the virus, but if I have the virus, it protects you from getting it from me. I don't understand why it's so difficult to just see. I'm sorry, I'm kind of lost my train of thought. But I also sent this to Nick just recently because I know he's big into personal responsibility and freedom. And what I want to know is, do you all vote no on all ordinances require personal responsibility and limit freedom? Because all safety ordinances do that. They limit one person's freedom so another person will be safe and does not require just their personal responsibility to be safe. The reduced speed limit down. I'm sorry.
1 minute.
Downtown. Okay, thank you. Protect citizens from getting hurt, and isn't it their personal responsibility to not get hit in the crosswalks, and infringes on my freedom to drive at whatever speed I want to. Hazardous tree ordinance does the same thing. It's your personal responsibility not to get hit by my hazardous tree. Why can't I grow my grass as tall as I want? Why can't I keep my dog off of leash? Everything infringes on my freedom. It's your personal responsibility. So we as a society need to have more personal compassion and empathy. And I really appreciate you guys. So thank you. Bye-bye.
Thank you, Carolyn.
Mr. Mayor, that's the last of our raised hands, so we are closing public comment at this time.
Thank you very much. Okay, Nick. Josh, can you hear us, or do you want to speak? Okay. Nick?
Okay. Well, I appreciate everybody's comments, and I have exchanged some emails with Ms. Mulholland. And as I've said before, I am not against masks. I'm against mandating it for the reason that I don't think we have the authority to do it. I think it's government overreach. Yes, we do pass ordinances on a lot of different topics that we have the authority to do. I don't believe we have it in this case. I think it's counter to our Constitution. And so, one, I don't think it's legal. I do think it's unnecessary. And I have some concerns that we as a city are going to get sued over this mask mandate. And I believe if we do, we're going to lose. So, and even if it is legal, I think it's unnecessary. We've been referring to this since March, I believe, as the emergency declaration. But I think we're past the emergency part. We're now at the part of what do we do day to day to live with this thing? A tornado is an emergency when it rolls into town and destroys a lot of stuff, and we interrupt everything while we try to get back to normal. An auto crash in an intersection is certainly an emergency. And we probably had an emergency in March when we first found out about this, and we were trying to figure out what to do, and the governor was shutting things down and declaring all kinds of declarations. But now we're getting past that. We're getting to the point where we're not so much an emergency anymore as how do we deal with this day to day and still allow people to go on and live their lives and run their businesses and adapt until this thing is gone somehow, either gone or cured or whatever. And I would reiterate what Governor Stitt said, that we should not be passing laws that we can't enforce, which is why he has not passed a mandate at the state level. We as a city should not be passing laws that we can't enforce, and the majority of our citizens don't want, and many won't obey. And yes, I say the majority of our citizens don't want this. I absolutely believe that. And the rest of the council needs to take that into consideration and pay attention to who elected us. You know, I've often said, I think I said in one of our meetings in the past, you know, people can only be governed to the extent that they are willing to be governed. And I think we're dangerously close to overstepping that line. The public has had enough. They're angry, and that's why we see a lot of the vitriol that's out there, and as we deprive people of their rights. And yes, this is a citizens' rights issue as well as a health issue. And those rights don't go away because we're dealing with a virus. The original goal was to flatten the curve, and we did that. Things are increasing now, but I don't think we're out of control yet. But as everybody has asked, what's the end game, and what now, and where does this stop? As I've said many times, I'm not opposed to masks, and in fact, I encourage many people to wear them. I wear a mask when required or when I feel that I should, but it's not government's job to mandate it. As many have said here tonight, people and businesses should make that decision for themselves. If you're a business and you want people to wear masks, that's great. Put the sign in the door and people can decide whether they're going to come in. Or if a business doesn't require it, but you feel better wearing a mask before you go in, then by all means do it. That is the personal responsibility part that I keep reiterating. And that's what we had before we passed this mandatory mask ordinance. we were working on a voluntary basis, and it was working pretty well. Actually, we were doing as well, if not better, than surrounding communities that did have mask mandates. So I would like to see us not extend this thing. I don't think it's necessary. We have people, more and more people complying, and the ones who aren't probably aren't going to anyway, and we can't go out and arrest them all. So just in summation, I don't think it's necessary. I would like to urge my fellow council members to vote against extending this unnecessary mask mandate, and let's go back to letting people and businesses decide for themselves.
Thank you very much, Nick. I'm glad we didn't have a 5-minute limit on you.
Did I go over?
I'm just kidding. David, Mr. Chapman?
Yeah, so I think Nick makes some really good points. I am concerned and I worry about government overreach. I was elected to protect the freedoms and the rights of Edmond citizens. I was also elected to protect the safety and the welfare of citizens of Edmond. So that's where the issue comes, as to how do you do that? How do you protect people without overreach and protect those freedoms and also protect the safety and welfare of them? And at times, the limits, the rights and freedoms are going to be limited in that protection. And I think there are very few situations in which that should happen. And I'm disappointed that we are put in a place in which we have to do that, because it makes me really proud to see people concerned about their freedoms and their rights, and want to protect those, because that's what our country and our state and our city stands for. So I'm proud of that. But at the same time, I do think that there are very few situations in which we have to do that and infringe on those rights. And that's what makes this difficult for everybody on this council and all the city councils in the state. We're all making this decision independently. And so I just so appreciate the citizens' patience with us and understanding that whatever decision that this council makes, we're making it as to what we think is in the best interest, and we're going to do the best we can.
Thank you very much, David. One of our number one goals in our community to get us back to normal, the end game, is to really support our school system's efforts in our community. And I think normal is when the kids are finally going back to school full time. And the sooner the better. And I'll keep reiterating, things won't be right until the kids are in the classrooms and the parents are working, the teachers are teaching, and everything else will work better for everyone else. And we won't have to do these Zoom meetings anymore. Right, Nick?
Right.
Okay. I guess it's time for us to call the question on this. Do we have a motion to approve item 2 on our agenda, the public hearing and consideration of ordinance number 37-99? You have a motion?
Make a motion to approve the ordinance.
Okay. Do we have a second?
Second.
Okay. Very well. Cindy, would you call the roll, please?
Council members Davis?
Yes.
Moore?
Yes.
Massey?
No.
Chapman?
Yes.
Mayor O'Neill?
No. Do we have a motion for an amendment, for emergency amendment?
I move that we have.
We're looking for a motion to declare an emergency so that this ordinance will go into effect immediately. So do we have a motion to do that?
So moved.
Second.
Okay. Cindy, would you call the roll, please?
Council members Moore?
Yes.
Davis?
Yes.
Chapman?
Yes.
Massey?
No.
Mayor O'Neill?
Yes. The motion passed. The emergency has been declared, and this will go into effect immediately. We need a motion now to update the city staff and the revised declaration of emergency regarding the COVID-19. issued on August 24th. The proposal is to extend it to 30 November. Is there any discussion on this particular motion, council?
No. Mr. Mayor, would you remind people what that is about?
This is our emergency that we declared part of the national pandemic. This is the emergency that instituted all the rules that we originally used to close the businesses and then later reopen them. And it requires citizens to use practice safe distances, to wash their hands, to avoid, if you're in a vulnerable age, avoid going to public places that could infect you. It's all the things that we've been extending since day one, minus the change that it was about to expire on the 12th of October, and we're just extending that with a new date of November 30th. Do we have a motion to approve? Do we have a second?
Second.
We have a motion and a second. Cindy, would you please call the roll?
Council members Chapman,
Yes.
Moore,
Yes.
Davis,
Yes.
Massey,
Yes.
Mayor O'Neill.
Yes. The revised declaration of emergency for COVID-19 has been extended and approved to the 30th of November. Thank you, council. Any further business to discuss? Our next meeting will be Monday. Next Monday at 5:30, it'll be a regular city council meeting. And the agenda will be published probably tomorrow. If there are no further questions, I would entertain a motion to adjourn.
Move to adjourn.
Second.
If you want to adjourn, raise your hands. Okay. This meeting is adjourned. Thank you all very much, and thank you, public, for listening to us. Appreciate it.